Hello students, welcome to the first video lecture for Healthcare Ethics for Fall 2020. This lecture will cover logistical information about our course, information about citations, and the reading for this week, which was entitled Ethical Foundations of Clinical Practice, and it is a chapter from the Handbook for Healthcare Ethics Committees, which was written by Linda Farber Post and Jeffrey Bluestein and published in 2015. I will be speaking throughout the lecture about the worksheet that you guys are completing for this week, so it's a good idea to have a look at that worksheet before you watch this video. And when I get to the reading itself, I'll be quoting from the article and giving you specific pages to look at. So it's a really good idea to have your reading open while you watch this video. Okay, so logistics. A lot of you guys have heard me give this spiel already, but I'm going to go through it again here just to make sure that everyone is on the same page as we begin the semester. So, first of all, this is an online class. If you are watching this video, you probably already know that. In order to complete this course, you are going to need a computer with access to the internet. It will be very hard to do this whole course on your phone. If you don't have a computer, or if your computer breaks halfway through the semester and you can't fix it, you can get one through York's device distribution program. And if you don't know about that, then you can get there by following the link on our syllabus, or you can just try Googling York College CUNY device distribution. What they do is they loan out iPads and Chromebooks for the semester, and it's their job to make sure that you have the tools that you need to do online coursework. I would advise going for the Chromebook, if possible. At any rate, if you do not have good internet access, the York IT department might be able to help you. Give them a call. Their number is listed on our syllabus. Second, all of the material that you need to complete this course is accessible through Blackboard, which means if you cannot access Blackboard, you cannot complete this course. If you are having trouble accessing Blackboard, definitely call the IT department or email them at helpdesk@york.cuny.edu. Third, this course is going to involve a lot of emails. I sent out an email on Sunday afternoon to verify the email roster that I have for this course. The subject line of that email is Fall 2020. The subject line that got sent out with that email is very long and elaborate, and it has the header that Blackboard appends to all of our course emails. So it begins 2020 Fall Term 1, Healthcare Ethics, Phil 308 R338528, York College, and then it says email contact for class. So all you need to do is find this email and hit reply and let me know that you got it. A bunch of you have already replied, so thank you very much for doing so. If you haven't replied yet, please stop this video now, go check your email and reply to my email so that I know that you got it. And if you can't find that email, this is a problem. So you need to contact me and let me know. You will find my email address to contact me in the syllabus as well. And you will find all of the course material, including that fine syllabus, on Blackboard. The weekly readings worksheets, and video lectures will all be in the course materials folder for each week. If you're watching this, that means you probably already found it. Good job! Okay, so I will talk about the major assignments and exams for this course in future videos, but what's important to go over now is the weekly worksheets for the course. So all of the readings for the semester are already up in the course materials folder for each week, and every Sunday I will post one of these video lectures, an audio recording of the same lecture in case your internet won't load the video properly for some reason, and a worksheet. It is your responsibility to do the reading, watch or listen to the lecture, and complete the worksheet. The worksheets are how I know that you are watching the video and doing the reading and participating in the course. Worksheets are due each Friday at midnight at 11:59 p.m., so right before Friday turns into Saturday. This means that your next worksheet, the worksheet that accompanies this video, is due on Friday, September 4th. You will submit your worksheet via the Assignments tab on Blackboard. If you encounter any trouble submitting it, if it doesn't go through, if it gives you an error message, simply email it to me. Okay? So you have my email in the syllabus. You can send it directly to me by email if it doesn't work through Blackboard. And I will return your worksheet with comments via email before the following Friday. If you have questions about the worksheet, or about this lecture, or about the reading or the course in general, please write them down so you don't forget, and bring them to our weekly discussion session on Thursday at 6 p.m. So this takes place during our regularly scheduled class time via Blackboard Collaborate Ultra. You get there through the Blackboard Collaborate Ultra tab on Blackboard. If you are having trouble accessing it, I know some of you did last week, send me an email and I will send you more detailed instructions. And remember that this is set up as a question and answer session, and we're only going to stay for as long as you have questions. So do try not to come terribly late, as we might all be gone by the time you get there. Okay, and most importantly, don't be afraid to ask questions. Even if the questions that you have are silly, if you think they're silly, if you don't think they're worth asking, ask them anyways. Questions are the most important part of learning. Okay, and the last point in this logistics lecture, this logistics part of the lecture, is that there's a Google Docs version of this worksheet linked in the course materials folder and in the notes below. This is just in case you have a computer like a Chromebook that doesn't play well with Word documents. If you open the Google Doc and you're like, hey, why can't I type in it? Don't request access. The one that you're looking at is the copy that needs to stay blank for everyone. So instead, go to File and select Make a Copy, and then you will have your own copy to write on, and no one else will have to read your answers. Okay, so that's the end of my spiel on course logistics. If you have any other questions, send me an email or bring them to our Q&A session on Thursday. All right, on to citations. So we will be doing MLA style in-text citations in this course, and we'll be doing a lot of them. There is an explanation and an example in this week's worksheet. As a side note, MLA style citations are more commonly used in literary studies than in the medical field. The letters MLA stand for Modern Language Association. We're doing them in this course because they are a standard citation style that is easy to use. And it also happens to be the one that I know best because I received my PhD from an English department. So I've used it a lot in the past. So that means it's a citation style that's easy for you guys to learn and easy for me to teach. Okay? And I'm here to tell you that citations are important. I know you don't believe me, but they are, I promise. And the first and most important thing about them is quotation marks. So this is really basic, but it's really important to go over. Quotation marks work to set off your language from the language of the text. So it says, these are my words, and these are the words that I am borrowing from someone else. Quotation marks go around any set of words that you borrow from another text. They frame it like this. And then you follow them with a parenthetical citation. So it's parentheses, author's last name, and then the page number where you found those words. So words in quotation marks, parentheses, author's last name, and then page number. And that tells me, the reader, here are the words I borrowed, here's who wrote them, and here's where to find them. So when you paraphrase the text, that is, when you say the same thing in other words, you don't use quotation marks, but you still need citations. And we'll talk more about that in future lectures. This week, we're going to focus on straight up quotes from the text and following them with proper citations. So you'll note that the readings that we are doing are also full of citations. So this week's reading, in fact, has a lot of parenthetical citations, but basically no quotation marks. Why? Because they're paraphrasing, or they're just sending you to find a reference to back up the claims that they are making. So if you look, for example, on page 9 of this week's reading, you'll see a bunch of parenthetical citations. The authors of this chapter are using an author date style, like APA or Chicago style. So the names that you see are inside the parentheses at the end of sentences. The names are authors' last names, and the numbers are the year of publication, not the page. But honestly, that doesn't really matter too much for us. The reason I'm asking you to look at the citations in the readings is to explain to you that the ultimate job of a citation is to show your reader how to find your information source. So, if you look at the second paragraph on page 9 of this week's reading, towards the end of the paragraph, a bit below the page number in the margin there's a sentence that reads, quote, "There is also a distinction between negative and positive rights, the former being the right not to have one's self-chosen plan controlled or interfered with, and the latter being a claim on others to behave in certain ways." And then there's an open parentheses, the name Takala, and the year 2007, and a closed parentheses, and then a period. So note that periods come after parentheses, not before. Okay, so if I read that sentence and I wanted to learn a bit more about this distinction between negative and positive rights, which does sound a bit confusing to me, I would look at the citation at the end of the sentence, so Takala, 2007, and then I would go to the work cited at the end of the document. And there I would find a bibliographic entry that corresponds to that parenthetical citation. And that is under, so that's in alphabetical order. It's under T, and it says Takala T, 2007. Concepts of person and liberty and their implications to our fading notions of autonomy. So that's the article title, written by T. Takala, lots of T's, and it was published in the Journal of Medical Ethics, volume 33, number 4, pages 225 through 28. So if I wanted to learn more about the distinction between negative and positive rights, I could go look up the Journal of Medical Ethics on the library website and find Takala's article, and then read about concepts of person and liberty as they indicate in their title. Okay? But I know that was like a really long set of things, and you don't need to worry about them yet. I'm telling you about it here because I want you to know how people use citations, that they aren't just obnoxious things that your teacher makes you do, but they're actually useful tools for finding information. They're tools that you can use too, based on, if there's something in the reading that you're confused by and you want to read more about it, you can go look up the source, okay? So you don't have to worry about going there right now, but it's a useful thing to know how to do. And citations can also tell you a lot about the author's attitudes. So where people are anxious, they tend to use a lot of citations. And they do this because they're afraid that they'll get something wrong or that they're saying something that will get them in trouble. So if you look on page 12, you will note that there are a ton of citations, way more than elsewhere in the article. Why? Because the authors are afraid to talk about race and culture, ethnicity, and gender. So it tells you a bit, because this is an introductory article, it tells you a bit about the discipline of healthcare ethics as well. Bioethics is very white and very American and very heteronormative and very male. But there are lots of cool people out there who are trying to change that, and some of whom we will be reading in this course. But we will also be reading a bunch of classic texts in the field. So it's worth keeping these biases in mind and reading the course materials with a critical eye. Okay, so for your purposes, this week, all you have to do in terms of citations is follow the instructions on the worksheet. It asks you to give an example citation from the article that we read and to use citations in your definitions of the key terms using the MLA style that we talked about, okay? So citation, quotation directly from the text when you're defining those terms, and then parentheses, author, page number, close parentheses, and the sentence. All right, so now, finally, on to the reading. This week's reading was a chapter titled Ethical Foundations of Clinical Practice from the Handbook for Healthcare Ethics Committees. We, obviously, are not a healthcare ethics committee. We're a healthcare ethics class. But this chapter gives a broad overview of a lot of subjects that we will cover in great detail over the course of the semester. And it's relevant to all sorts of people in healthcare fields, not just specific ethical professionals on healthcare ethics committees. Okay, so I'm going to walk you through the essay here and give you some important tips for reading critically. but it's your job to read the article and to show me that you've done so and that you've thought critically about it by answering the questions on your worksheet. So the first tip that I can offer is to look at the list of topics right at the beginning of the article. So they appear right under the title on the very first page, and they give you a list of the topics that the article is going to cover. So they say they're going to cover the role of ethics in clinical medicine, ethics committees in the healthcare setting, fundamental ethical principles, principalism and alternative approaches, the role of culture, race, and ethnicity in healthcare, and conflicting obligations and ethical dilemmas. And you'll note that these actually correspond with the subject headings throughout the article. So they're giving you, in brief, a list of the important things that they're going to cover, right? So something like this, I'm sure you've heard this before, but something like this is a really good study tool. So it's a really good thing to go back to when you're studying for the midterm or the final for this course. And you'll see things like this in a lot of our readings for this term. Very often you'll see abstracts instead of a list like this that gives you the sort of key points that the chapter is going to cover. You'll see like a little paragraph that'll give you a summary of the whole article. And the point of these things is to sort of condense a lot of information into a short format. And that's not a substitute for reading the whole thing, but it's a good tool for studying because it can help you figure out what things to focus on when you're reading. So these headings tell you specifically what the authors of the text want you to focus on. And, it's helpful to know what your authors want you to focus on. You can always focus on other things too, and I'll give you some other things that you might want to focus on as we go through here. So the reading starts out with a case study. And we'll have a few case studies in the readings for this term. They are a standard way of teaching healthcare ethics. The case here concerns a Jehovah's Witness, a woman who is a practicing Jehovah's Witness, who was in a car crash. And the name of this fictional character is Ms. Lawrence. I want you guys to note that Jehovah's Witnesses are classic examples for medical ethics. And this is because this religion has a very clear doctrine about medical intervention, specifically about the refusal of blood and blood products, which can come into conflict with medical procedures. So it provides a really good example, because oftentimes people want to writers are interested in contrasting religious principles with other forms of ethical obligation. But this use of Jehovah's Witnesses as a sort of classic example in medical ethics also betrays a curious function of the discipline to seek exceptions to the ordinary. So this isn't a case, for example, about a woman who has diabetes and can't afford insulin, which happens all the time. But instead, it's a case, and it happens all the time and is something that medical ethics actually has something to say about and something useful to say about. But we're not presented with such an ordinary case here, right? Instead, with the case of Ms. Lawrence, we get a case about a life and death situation that is fraught with drama and moral anxiety and religious convictions. So you might get a sense that medical ethics has a little tendency towards drama. But also, as I mentioned, that there is a strong connection between religious ideas, religious principles, and ethics that actually has quite a long history in the Western intellectual tradition. But A thing to note when you guys are reading this example case at the beginning of the article, in the second paragraph, there's a line that reads, quote, "Her answers to Dr. Thomas's questions reflect understanding of her condition, the treatment options, and their consequences." So what this is doing here is it's showing her competence to consent. So competency is a thing we're going to be talking about very soon, so I thought I would flag it for you here. It's not something they talk about too much explicitly in this reading, but they're giving you a sense of it there. So her answers to Dr. Thomas's questions reflect understanding of her condition, the treatment options, and their consequences. So just keep that in mind. Also note the questions at the end of the case. They tell you, just like that list of terms at the beginning, the questions at the end of the case tell you how to read it. So the questions are, what are the conflicting professional, legal, and ethical obligations? What is the role of the ethics committee in resolving this dilemma? What resources are available to help you? These questions tell you, they set up what the rest of the chapter hopes to answer, right? They set up this set of concerns, and then they say, okay, now we are going to tell you, here's what medical ethics will do. Okay. So moving on in their article, another really useful term to think about, one that's going to come back to us later in the term, is fiduciary. This is not an ordinary term. But it's a useful one to know, and it's one of the key terms, one might say, of biomedical ethics. So they talk about a fiduciary relationship as a sort of answer to the question, why do we need ethics in healthcare anyways? So what is the point of doing all of this? Can't we just, go on and do healthcare without all these silly ethical questions, without all these dramatic situations? So their answer is the fiduciary relationship. So if you look at the second paragraph in the section titled "The Role of Ethics in Clinical Medicine," which appears on page 4, they write, the authors of this article, "While ethics informs all worthy endeavors, it has special significance in the healthcare professions because of the fiduciary relationship between practitioners and patients." So anything worth doing, in their opinion, involves some ethics. But ethics is super important in healthcare because of this particular relationship between healthcare providers and patients. So a fiduciary relationship exists when one party, because of superior knowledge, skill, and authority, assumes responsibility for the welfare of another party who is in a position of reliance. So a fiduciary relationship involves unequal power relations. Someone who has all of the knowledge and power and skill and authority, and someone who does not. Someone who is in a position of reliance, who relies upon this other person. And that means it is a trust-based relationship. So fiduciary, we can basically translate as trust-based. In this trust-based relationship, fiduciaries have heightened obligations, including the moral imperative to put the interests of reliant parties ahead of their own interests. So here, that means that the healthcare provider has a moral obligation to put the interests of the patient ahead of their own. Patients, they write, whose illness, injury, disability, pain, or suffering makes them vulnerable, place themselves in the hands of healthcare professionals based on the confidence that their well-being is the practitioner's highest priority. So what they're talking about, this relationship of trust between the provider and the patient, depends upon the vulnerability of the patient and the patient's trust in the knowledge and skill and ethical responsibility of the healthcare provider. So, because of the trust that the patient places in their provider, the provider has ethical obligations to the patient. This is what it means to be a fiduciary. The role of this course is to teach you some of those obligations and the basic ethical principles for understanding them. So the next section of this essay that we're reading deals with the institutional history of ethics committees. And it's not particularly relevant to us except for this idea of reading critically, which is one of the things I'm hoping to teach you guys to do in this course. So on page 5, they sketch out a connection between autonomy and identity politics in the 20th century, which it's worth being a bit skeptical of, especially in light of the discussion that follows on the origins of healthcare ethics. So on the bottom of the page, they quote a 1995 article that describes hospital ethics committees as a, quote, politically attractive way for moral controversies to be procedurally accommodated. So let me read that again. In their august opinion, hospital ethics committees are a, quote, politically attractive way for moral controversies to be procedurally accommodated, which means, in my cynical opinion, that they are a way to avoid bad press, and I would argue legal trouble, but also, and this is what the procedurally accommodated bit means, they are a way to fit big moral questions into the bureaucracy of a functioning healthcare system, into the everyday activities of a hospital or a nursing home. So they talk about how ethics committees came out of sterilization committees. So straight out of eugenics, like bad shit. And abortion selection committees, which were, despite the name, basically there to deny women access to abortion rights before Roe versus Wade. And dialysis selection committees, which are a little less sketchy, but were about the distribution of a very scarce resource before dialysis became the enormous industry that it currently is, when it was not readily available and very much in demand. The modern version of this is the selection committees for organ donations. And healthcare ethics also came out of these things called institutional review boards, IRBs, which still exist today. So we're actually not going to do any experimental ethics in this course, any research ethics. And The reason for that is I don't think it's going to be super relevant to you guys in your careers, but I'll give you a little bit of my spiel about it now because it came up in this reading. So institutional review boards, in the author's words from today, quote, responded to the revelations of abuse in medical experimentation by reviewing all government-funded research in using human subjects. So IRBs responded to revelations of abuse in medical experimentation. By revelations of abuse, they mean the Tuskegee syphilis study. So IRBs were instituted in the 1970s, which is when the Tuskegee syphilis study came to light, and it came to light in the press. So we were just talking about bad press, right? Journalistic outcry, public opinion. So the Tuskegee syphilis study was a 40-year experiment run by the Public Health Service of the United States of America, which observed the progress of untreated syphilis in Black men in the rural South from 1932 to 1972. It was a non-treatment experiment. So the point of this experiment was to watch these men die slowly from syphilis. So the purpose of medical ethics in general, and of institutional review boards in specific, is to prevent this kind of experiment from happening again. But it's worth noting that they are reactionary formations and that they don't always work. But you might be thinking, why would I want to study this? It sounds so stressful. So I will give you the answer that the authors give in our reading for this week. And it's on page 8, right before the section break, that says fundamental ethical principles. So they write that bioethics is an integral part of the work that healthcare professionals do every day, which means that if you're planning to go on to a career in healthcare, you'll actually be doing bioethics all the time, whether or not you know it. You'll be making ethical judgments and ethical calls just in the course of your ordinary delivery of medical care. And they continue, the healthcare organization, and all those who practice in it are moral agents with ethical obligations that cannot be delegated. So you can't get away from it, but at the very least, you are a moral agent. So you have some moral authority. All right, so in other words, this discipline, despite its dirty laundry and sordid past, can provide you with some useful tools for functioning in modern healthcare. So I'm going to give you a list of the sort of 4 big principles and a couple of little ones in here too that they describe as the fundamental ethical principles, and they're principles that we are going to be returning to a whole lot in this course, so it's important to get them down now. And the worksheet that you guys are doing for this week actually asks you to define all 4 of these terms. And I've given you the first one, autonomy, so you have an example of how to go about doing the definitions. So autonomy is the big one, the one we start out with in this course. And so what I'm going to do here, I'm not going to give you the definitions because it's your job to find them for the worksheet, but I am going to give you the etymology, the roots of the word, which is a good way to sort of understand where it's coming from and what it means and to remember it. It's just sort of good tools for knowing how language works and the way that words carry meaning. So autonomy comes from two Greek words, auto and nomos. Auto means self, like automatic, and nomos means law or rule. So autonomy, autonomos, is self-rule or self-law. So it's making your own rules, setting your own laws for yourself. Beneficence comes from two Latin words, bene, which means good, and ficere, which means to make or do. So beneficence is just to make good or to do good. Pretty straightforward, right? So beneficere, to make good, to do good. A word that comes up in their definition of beneficence, which we are going to encounter again in this course, so I thought I'd derive it for you here, is paternalism. Paternalism comes from the Latin word pater, which means father. So like patriarch. Paternalism basically means father knows best. So that's an easy way to remember the definition of it. And it's a word that we're going to come back to. In healthcare ethics, it's often a negative term. So autonomy, autonomos, beneficence, beneficere, to do good, paternalism, pater, father, father knows best. Okay, nonmaleficence, I bet you can guess, has some of the same roots as beneficence. So it comes from three Latin words, non, which is a prefix meaning not or no, male, which means bad, and ficere, which means to make or do. So if beneficence is to make or do good, maleficence is to make or do bad, male, ficere, and non-maleficence is to not do bad or to not make bad. So don't make bad decisions, don't do bad things. Non-maleficence, okay? So don't do anything bad. And justice, I can't break down for you too much because it basically comes straight from Latin. So justitia is a Latin word that means righteousness or equity. But what we can get from this is to note the emphasis on equality in the definition that we get here. They discuss, quote, treating similar cases similarly and dissimilar cases dissimilarly, which means treating equal things equally. And the form of justice that we're going to be talking about the most in this course, when we get to justice later in the semester, is distributive justice. And distributive justice is about the equal distribution of goods in a society, and specifically here, the equal distribution of healthcare and healthcare resources among a population. So that's it for etymology. They go on to describe some other approaches to healthcare ethics in the following section, but they don't go into them much because principalism, i.e. relying on these four principles, autonomy, beneficence, non-maleficence, and justice, principalism is the name of the game. It's the main force in healthcare ethics, and it's the version of healthcare ethics that you guys are going to be learning in this course, for better or worse. Okay, so In the next section, we talked a little bit already about the next section on the social determinants of health, or, quote, the role of culture, race, and ethnicity in healthcare. The important part of the cultural differences paragraph on pages 11 through 12 comes at the end. So they write on page 12, the same commentators also point out that cultural determinants influence the values and attitudes of physicians as well as those of their patients. The result is the potential for misperception and miscommunication when the parties to the clinical interaction come from different backgrounds. So that means that people are really bad at talking to each other. But what's important here is not just thinking about cultural differences as something that belongs to the patient, but as something that appears on both sides of the healthcare interaction. So we all perceive the world through culture. And your understanding of the situation that you're in might be a little bit different from your patient's understanding. So the idea of cultural competency is that it's important to be generous to your patients and also to be generous to yourself, and recognize that you are both seeing the world through your own cultural lens. Okay? So last but not least, they talk about conflicts and ethical dilemmas. So this is the bread and butter of classic biomedical ethics, and it's something we'll talk about a fair bit in this course because understanding these conflicts and in thinking through them in advance can help you deal with them if you encounter them in the real world. So take a look at the paragraph that begins on page 13. The tension between and among ethical principles may create dilemmas for clinicians when their obligations are in conflict. So a bit further on in that paragraph, they write, in other instances, an individual may be required to respond to different moral imperatives, each of which are clear, but both of which cannot be discharged at the same time. So what they mean there is that these sort of key principles that we've talked about, and they're going to give you some examples in a sec, these key principles that we've talked about often come into conflict. And that there are often very clear moral imperatives that are very different and don't agree. So they write, for example, healthcare professionals are required to respect and promote the autonomy of their patients and protect and enhance their well-being. So these things might not always agree. Autonomy and beneficence, they might not always line up. Care professionals are also required to provide care for those who need it and to be responsible stewards of limited resources. So you might think there, for example, about antibiotics. Antibiotics are super useful tools, right? But there's been a lot of talk in recent years about overprescribing of antibiotics. And so if you are someone who is prescribing antibiotics, you need to worry about creating antibiotic-resistant bacteria. So you don't want to prescribe antibiotics for every case of the sniffles, but you have a responsibility to provide care to those who need it. So it's your job to figure out who really needs antibiotics, and at the same time to be a responsible steward of this resource, which in this case is not limited, but needs to be limited, because it could be dangerous. Okay, so care professionals are required to provide care for those who need it and to be responsible stewards of limited resources. They are also required to protect patient confidentiality and to alert vulnerable third parties who do not know they are at risk. So you might think about this even in relation to coronavirus and contact tracing. So do people have the right to confidentiality regarding a diagnosis of COVID-19? This is a thing that people talked a lot more about during the AIDS crisis because there was such stigma around the disease, but also because it is a disease that is communicable. So there's a question of an ethical obligation to alert vulnerable third parties who might be at risk of contracting the disease, but also to protect the patient's confidentiality regarding their diagnosis. Okay, so we can see already there are a lot of conflicts brewing, right? And this is where our article turns back to Mrs. Lawrence, the car crash victim. And she comes in as their example regarding the first conflict in that sentence, that care professionals are required to respect and promote the autonomy of patients and to protect and enhance their well-being. So she concretizes this conflict between respecting patient autonomy and providing necessary patient care. So in closing, I will ask you to think about the role of ethics in this case. So what does ethics do here? What is the role of healthcare ethics in this specific example case? Besides wasting a lot of time, which probably isn't realistic in the case of a car crash victim, it seems to me that healthcare ethics negotiates between the physician's ethical obligations of beneficence and nonmaleficence to the patient and the patient's religious convictions, her autonomy, her right to make her own rules and decisions. So justice, the fourth core principle, doesn't play a big role in this case, but we'll get to lots of cases in which it does play a role later in the semester. All right, so I'm going to leave it there. That's all for this week. If you have any questions or concerns, write them down so you don't forget and bring them to our discussion session on Thursday. And I'll see you then. Take care.